Details. Morning, Tom.
Good morning, Sarah Jane. Yeah, that landmark is 40 years this week since the birth of the first test tube baby, Louise Brown. But here in the UK, where it all took place, couples now face what campaigners are calling social rationing of fertility treatment on the NHS. They say as well that Louise's parents would actually have been turned down for IVF today by the majority of England's clinical commissioning groups because of more stringent rules and the postcode lottery that they are campaigning to change. Sky's Lorna Shattuck tells us more.
Emma Eadie's pink fertility file has been getting steadily bigger over the last couple of years. But letter after letter from hospitals and even MPs haven't been able to get her the one thing she really wants: a baby.
I just feel it'll complete us, and that's all I've ever wanted.
Emma and her husband Lee both have health problems that doctors agree would make. But IVF isn't available on the NHS where they live. When Emma appealed last year on the grounds that her bowel disease means she's in exceptional circumstances, she was again refused.
To have to tell people you need IVF, but you won't be getting it, that's even worse, because they've just completely taken away everything, taken away both of our dreams. We just want to be given the opportunity to have what all our friends have got, you know, and to be able to celebrate Christmases and stuff like a family, as families do. And it just doesn't seem fair that my friends 10 miles down the road can have it, but I can't.
Those geographical differences arise because it's up to local NHS providers, the clinical commissioning groups, to decide which treatment should be available. That's why here in Colchester, Emma and Lee weren't able to get IVF on the NHS, even though 15 miles away in Ipswich they would have been able to. The National Institute for Health and Care Excellence, or NICE, does have guidelines saying that women under 40 who've been trying for 2 years to get pregnant should have access to 3 full cycles of IVF on the NHS. But crucially, those guidelines aren't binding.
The charity Fertility Fairness says only 4 commissioning groups in England now offer that gold standard, 3 IVF cycles, even for couples who have children from previous relationships. 7, including North East Essex, where Emma lives, have suspended all IVF provision. The vast majority, over 60%, only offer 1 full or 1 partial IVF cycle.
We believe that there should be fair access, so NICE guidelines are there, as I say, because financially and medically they're the best way to achieve the outcome that you want. So therefore, we believe that everywhere in the UK should be offering those in line with the NICE cycles of IVF.
But IVF is expensive. Costs vary, but just 1 cycle at a private clinic can have a price tag of around £5,000. Money it seems the NHS can ill afford. NHS Clinical Commissioners told Sky News that unfortunately the NHS doesn't have unlimited resources, and ensuring patients get the best possible care against a backdrop of spiralling demands, competing priorities and increasing financial pressures is one of the biggest issues CCGs face. As a result, there are some tough choices that have to be made, which we appreciate can be difficult for some patients. Despite the difficulties, Emma didn't give up. And after another appeal, last month was told she can have IVF treatment locally. She's yet to find out how many cycles and where it can start, but she's hoping her wait might finally be nearing an end. Lorna Shattuck, Sky News.